Hello. Hi, this is Dr. Anjali Agarwal. I'm a consultant physiotherapist. I've been working a lot with relations to women's health. And today, the topic which I would talk about is heal your core, or I know you tore your core. Most of the times, women who have issues with a bulge tummy or they feel that they lack some kind of strength in their core, it could be just not something which is more cosmetic but more physiological. uh, Going forward, what could be we'll be looking at in this agenda will be to look at the cause of the fresh stage of women's health. Yeah. uh, Most of the times women have issues which is relating to their core, and we know that they have actually got a damaged core or a damaged pelvic floor. So, we'll be talking about how we can make changes in this kind of particular circumstances. Now, if we look at a general picture, as a woman comes from menarche area, women has something called as pimples, and as she enters into puberty, gets her first period, and women have issues with not getting periods in time. These are the young teenage girls. So, a lot of things which we term here is called PCOD. Then we see that in the growing periods around plus 21 years and all, when the childbearing age starts. So women has issues with pregnancy, back pains, to issues with incontinence. And then we have issues which is more related to menopausal symptoms. She always feels like hot flushes and she would want to the picture here depicts the funny angle of she wanting to go to the refrigerator all the time to just freeze herself, to feel and make her feel like more in control of her temperature, where she feels the hot flushes. Uh, Looking at how what women's health and as ourselves as health professionals and physiotherapists and women's health specialists, we deal with all stages of a woman from the time she enters puberty to being pregnant and to the time of being menopause. And during the time of entering the menstrual period, the women face a lot of back pains, which is very corresponding to their menstrual health. So there's a lot of things which we deal with menstruation, delayed periods, which we can term as hormonal imbalances or PCODs, hormonal imbalances, which is leading into painful periods or endometriosis, and menopausal health or hysterectomies and C-sections, vaginal deliveries and uterine prolapse and incontinence. There's so much to women's health that we deal with as women's health specialists. Uh, and let's all visualize like what are the things which we see in puberty is that the women are in rebellion, there's a growth spurt, there's a changes in the bone density meter. In pregnancy, it's a dream, the hormone, the physical, emotional, and the mental and the body changes a lot. And then we have the postnatal phase, which is like in a blur, which is a missed picture in a collage. And we are not, these moms are sleep deprived moms with emotional, mental, and physical exhaustion and in pain because of the good labor or perhaps a birth trauma. A lot of issues for these moms are not being addressed. And the menopause is a cranky time, and we blame it all on the hormones, and everyone talks about it. And all care is specific for getting women get a surgery or hormones level. So till now, all our care has been more medicalized and surgical based for menopausal women. But as women's health specialist, myself as Dr. Anjali, what kind of health we cater to these women? We'll be talking around that. Now, the new bubble which I need to burst is a sleep deprived, depressed mom, who's a postnatal mom. She has a new challenge, which is a small newborn baby, an infant in her hands. Totally new. She doesn't know why the baby crying or why the baby's not feeding or why a particular thing is happening for a particular baby. Yeah, thanks to all the classes which we take and we educate parents and moms about this. But there's a lighter, very big bubble which we need to actually look at and burst. Now, the new phase of postnatal period is a sleep deprived period, and postnatally, the same eye and hear them out. So, do we look at them at the same angle as what we used to do in the prenatal chain? Like, there'll be a marketing team coming and approaching you for a beautiful birthing suit and a birthing plan, but nobody ever comes and talks about how a postnatal mom is feeling or how a postnatal mom does. Now, how many checks has she has after the birth and by her care provider is very essential. And how many get assessed by your physiotherapist who's trained in pelvic floor rehab. Nowadays, we have a plethora of certifications. Anybody walking out of the door can certify themselves as a pelvic floor physio. But does it really mean that they know what a pelvic floor means and how a particular person needs to be treated? Because it's just not magic science with one kind of a pill which you can treat a certain condition. It requires a great understanding of a pelvic floor for a woman. Now, there are many basic questions which we really need to look at whether the woman is feeling okay to return to day-to-day activities. How many of we counsel them that how they're taking care of their health? Is their baby's health more of a priority, or they're also looking at their mental health and their physical health and their emotional health too? So there's a lot of things which we, as women health physiotherapists, want this to be learned by a lot of women. And a lot of things is being unsaid, a lot of things is hidden behind the curtains, and I think we are all coming up with a lot of issues now. Now, the current state of postnatal checkup, which we see nowadays in our country, is mostly they screen maybe, perhaps, for a postnatal depression, and they would have a conversation of birth control and family planning, or they would check for the healing stitches, how you are good with the vaginal stitches or the C-section stitch, or a pap smear for that matter. And what is missing here? And we are missing a big chapter here. We are missing on pelvic floor muscle assessment, the abdominal muscle assessment, the musculoskeletal assessment, the bladder bowel functioning screening, and return to exercise and goal setting. So these are the fundamental assessments which we as women physiotherapists would always ask a postpartum mom, and that is what goes missing in the long term. Now, the new assessments which we must be thinking, how much are you drinking? How often are you opening your bladder and bowels? Whether you feel urgent need to get to the toilet, whether you experience any urinary or fecal incontinence, any pelvic girdle pain, or any back pain, or mummy tummy pooch which doesn't go away. So these are the common questions we in our clinical setup would always ask a postpartum mom or mom who has delivered. Now, this is my favorite subject, and I am an advocate of diastasis recti, um, holistic treatment. And you see, there is always a tummy which is pouting out for called as a mummy pooch, or people say it's a cosmetic. You've gained a lot of fat on your tummy, and you really need to go down to the gym and work out. But that's the wrong with you. It's not a tummy fat. It's basically a damaged tissue which has just got lax between the two abdominal muscles. This is called as the rectus abdominis or the diastasis recti, which is separation of the two muscles, which creates a gap in between, and the tissue which separates the two muscles, the linea alba, gets stretched out. And if it's stretched out, it's all your internal organs can just peep out from that linea alba. It's like an old sock and a new socks concept. Like old socks will have small holes in it, and things can just pop out from there. That's what is happening in this case. So we really need to work out and think what it is, and it's not a cosmetic angle attached to it. So it's a mysterious pain. We see a lot of women with diastasis recti who have left untreated for about 10 to 20 years, end up having knee replacements, hip replacements, spinal surgeries, and neck pains, and a pelvic floor, repair surgery for the prolapse. Probably what we miss to assess them is for diastasis recti, because something like a cage, which is not holding your organs in place, might lead to a leak in the tissues coming out with organs also coming out. So we'll be coming back to more topics around it and how we can assess diastasis recti and what as women's health specialists, as Dr. Anjali, what I do, and a lot of things which we are doing in a telehealth session. I've been covering a lot of sessions which can be done online, and we have been helping women all around the world, whether it's considering diastasis recti, uterine prolapse, or fecal incontinence or urine incontinence. Do reach out to Dr. Anjali. My details are always available on the website. You can email me too, or and we can take in from there. So thank you everybody, and thanks for listening. We would surely come back to more questions and answers with regards to diastasis recti in an open forum. And this was a short discussion, mainly to spread awareness, because most of the women who are postpartum are never heard, and a lot of importance are not given to their bodily, physical pains, and cosmetic pains are what cosmetic issues are what mostly looked for them. So we will get back to you, moms, and happy pregnancy, and a happy postpartum. Smile more, eat well, and sleep more. Thank you, everyone, and we'll see you soon.